right. Welcome everyone to the next Biodesign and Public Health webinar. We have a new guest with us today, but first let me go ahead and introduce myself. I'm Dr. Candace Carpenter. I'm Co-Chief Executive Officer, as well as Chief Strategy Officer of the Boston Congress of Public Health. So happy to see so many of you coming in today and joining us. Hopefully we see a number of different familiar faces. Let me go ahead and actually just make the chat available for everyone to use, so you can utilize the chat as well as the Q&A. All right. And so unfortunately, we will not be having Miss Emmy Dunsford Hernandez today. She's actually on a flight to Houston, so you will not be able to join us. And Dr. LeCompte, who is co-CEO with me at BCPH, may be popping in a few minutes. But I wanted to turn it over to our guest, Mr. Justin Ayers, who is CEO of EqualityMD. So Justin, feel free to just give us the background about yourself.
Sure. Thank you so much for having me. It's a true honor to be here. So I'm a former healthcare trial lawyer, former history teacher, turned health tech entrepreneur. I've been playing in what I call startup land for 15 years now. This is my fifth company. When I was a healthcare trial lawyer, this was just as the Great Recession was starting to kick in, 08, 09, 10, and they're starting to get really ugly. And I saw a lot of my attorney friends lose their jobs, and eventually I did as well. And when I was an attorney, I was defending insurance companies in healthcare cases. And it was the only job I could get at the time because nobody was hiring. And I hated it. I know that everybody deserves representation, and I defended my insurance company zealously as I swore an oath to do. But at the same time, I saw firsthand just how inequitable our healthcare system was and how broken it was. And this was before Obamacare. And what we know now is the American Healthcare Act. So the challenges I saw and defended against didn't make me feel so good. So when I got that pink slip, I didn't feel so bad about it. I then I come from a musical family. My godfather's Liberace. I was born in Las Vegas. When Liberace died in '87, my family moved from the West Coast to DC area, where my mom's family's from, and they're all CIA Cold War assassins. So my choice in life was go on stage with razzle dazzle or kill for God and country. So I was the black sheep that went to law school, and both sides of the family said, "What are you doing?" When most families would say this is a good idea. So my first entrepreneurial venture was a coffee shop, and accidentally it became a safe place for LGBTQ youth in the Williamsburg, Virginia region, where I went to college at undergrad at William & Mary. And then I sold that and opened a restaurant nightclub in Richmond, Virginia called 2113 Bistro, and had that for about 3 years, and then sold that. Never opened a restaurant. It is one of the hardest things I've done, aside from passing the Virginia bar exam. And the restaurant became a community space for the LGBTQ community in the greater Richmond region in Virginia. And I didn't anticipate that because we didn't advertise it as an LGBTQ establishment. It just became one because people found out that the owners were owned and operated by LGBTQ people. At the time, the director of the community center, LGBTQ Community Center, Bill Harrison, approached me and said, "Would you be interested in starting an LGBTQ Chamber of Commerce for the capital of Virginia?" And I said, "Absolutely." So I was voluntold, I suppose, to create one of the NJLCC affiliate chapters, which is still growing strong in Richmond, Virginia, and that was in 2012. So I've been a very strong member of NJLCC for 14, almost 15 years now. Sold the restaurant, then dabbled in some arts consulting, but landed on LGBTQ marketing and media with a media company called Q Virginia, then Q Media. We published magazines, hosted the state's first same-sex wedding show before marriage equality was legal. We transformed the American Civil War Museum into an LGBTQ wedding destination and helped the Virginia Department of Health run anti-smoking campaigns geared towards LGBTQ smokers, and that was very effective. That became a consumer behavioral data analytics company. We took that through a technology accelerator in Richmond called Lighthouse Labs. In the second half of 2019, launched our MVP, minimum viable product, in March of 2020 when COVID hit. And when COVID hit, it stopped the world and it stopped our ambitions. And I was forced to reconsider everything, as many of us had to do at that time. And I looked back over the past decade or so of life in startup land, and I realized that been traveling across the country, talking to different people from pride organizations and Fortune 500 groups that I talked about, DEI initiatives back then, DNI. The biggest question I received from people from all walks of life is, where can I find a doctor who makes me feel safe as a member of the LGBTQ community? And I thought, this really resonates with me. I swore never to go back to healthcare after defending insurance companies and losing my job back in the day. But I felt drawn back to it because over the course of everything I've done, I've been building and nurturing and cultivating authentic relationships by showing up, being my authentic self, and giving first. And that earned trust is something that I thought I could leverage and transform those relationships into channel distribution partners to disseminate a product that was focused on health equity for our community. Then that's how EquityMD came to be.
Oh my God, excellent. Like there's so much to unpack with what you just told me, like a phenomenal background, starting like the 5 different businesses, from the copy shop, the nightclub, the Chamber of Commerce, marketing, and then now EquityMD, truly phenomenal. But I just wanted to recognize my co-CEO, Dr. Circe Lecomte, say hello to Justin as well as the audience.
Oh my goodness. I'm so sorry. I'm just a bit of a travel jam here, but it's such a pleasure to meet you. My name is Dr. Circe
Likewise.
Lecomte. I'm the co-CEO of BCPH along with Dr. Carpenter, and very excited about the biodesign series. We get a lot of traction and engagement from our audience, and I know folks are very interested in what the work you've done and engaged in, how it's improved health equity for LGBTQ people.
Well, thank you. It's a pleasure to meet you.
Awesome. So, you know what I think is a great time for us to do, Justin, if you wanted to play that demo so everybody could get a sense of what exactly EquityMD is. And we've done this with our other biodesign and public health series as well, to give us that great view. So whenever you're ready.
Sure, happy to do so.
Welcome to EquityMD, where we believe healthcare should be inclusive, empowering, and affirming for everyone. Our mission is to change how the LGBTQ+ community perceives and receives healthcare, and we've partnered with a virtual healthcare platform that empowers you to visit doctors and therapists where you can enjoy agency, dignity, and respect. For an affordable monthly subscription, you'll receive comprehensive care for your mental and physical health. As a founding member, you'll enjoy exclusive benefits, including access to a national network of doctors and therapists delivering respectful care, 36 virtual visits every year for your primary care, mental health, and urgent care needs, and access to over 1,000 of the nation's most prescribed medications, including PrEP, all delivered discreetly to your doorstep. You also have a dedicated customer support team ready to help you every step of the way. No insurance? No problem. Your monthly subscription covers all of your virtual healthcare visits, medications, and other services. No copays, no deductibles, and no surprise statements. EquityMD costs less than some insurance plans and significantly less than out-of-pocket expenses you'd pay for individual visits to doctors and therapists. It's a great option for those who are uninsured or underinsured, as well as for those seeking more inclusive healthcare options outside of their covered networks. Our comprehensive care package offers everything you need to become the superhero of your own healthcare story. Take pride in your healthcare and become a founding member today. Be sure to share your thoughts and ideas with us along your journey. Your feedback is invaluable as we expand and evolve our services to create the #1 platform for LGBTQ+ healthcare navigation and care delivery. This is only the beginning of our path as we pave the way towards a brighter and healthier future for all. Visit EquityMD.com today and let's transform healthcare together.
Oh my goodness. I absolutely love that. So that is the first time I've actually seen that video, Justin. And I will just say, just the power of that platform for LGBTQ people. But then I also think about similar platforms, right, for people who don't feel that they're necessarily seen and heard in the healthcare setting, right? And those could be, a variety of different, racial, ethnic minorities and otherwise. But yeah, tell us a little bit more about, because I know you mentioned how EquityMD came to be, but tell us a little bit more about how the journey has been for you. Any kind of great testimonials so far?
Sure, great question. So we started in 2021, and at that time, everyone was sheltering in place. And in terms of venture-backed capital, it was flowing like waterfalls at Niagara Falls. That's since stopped. But at the time, we were able to receive some funding and build a basic platform that was a telehealth platform that was HIPAA compliant, and we had providers and we trained them to be culturally competent using evidence-based standards, and also that took LGBTQ patients and built an AI matching algorithm that connected patients with providers based on each patient's intersectionality of identities and unique healthcare needs. And we found that, much like the studies have shown, 80% of our community says that mental health is their primary healthcare concern. We found that over 90% of the patients we served were coming to us for mental health reasons. And given the national mental health crisis and shortage for the nation, that we found that a lot of primary care practitioners on our platform were dealing with patients who were exhibiting mental health conditions. But the patients loved it. Not a single one of them had seen a provider, sometimes ever since rolling off their parents' insurance plan, or hadn't been for over a decade, because they didn't feel safe and they kept going by word of mouth and trial and error. And they just were fed up with the whole process of trying to find someone they felt safe being their authentic selves with. And providers wanted to reach this NIH classified health disparity population that is about 30 million LGBTQ Americans. These providers know that this community is out there. They know that it represents every other underserved demographic, from racial minorities to military veterans, but they didn't know how to authentically engage them in such a way that it would change their perception of healthcare, that they would then come to their offices. So we effectively drove an invisible patient population to the providers' digital doorsteps. And they loved it because they had the training to create that digital safe space. Then the providers had told us that they needed more bells and whistles, more features, because that minimum viable product, as I like to say, was a skateboard that got you from A to B. It wasn't exactly a Bentley or a Maserati. So in order to build more features, integrate with electronic healthcare records, have insurance on there, as well as prescription fulfillment, that would take a lot more time and money from a technical build. And the venture capital spigot was starting to close. So we decided that path had to sort of be put on pause, but we at least had the AI infrastructure there to come back to later. So we realized that the immediate need for our community was still present and growing, particularly for the mental health space. So we found, and we had to vet several telehealth partners to help get our product to market. And so we found one. It took 9 months to negotiate the right contract for our company. And this company I like the most because they wanted to incorporate DEI and principles into their corporate DNA at the onset, rather than find out later, we should have been thinking about this 5 years ago. Let's backtrack and put some Band-Aids here and some duct tape there and say, oh yeah, wave the rainbow flag, as many companies unfortunately do. And this company said, no, we want to do it right from the start. And so they're partnering with us. They gave us a good deal. And all of their providers have gone, that are on our platform now, have gone through the evidence-based cultural competency training. And many of the materials we receive for that training are not ones we generate ourselves, because we are not medical providers. We utilize the National Institute's, the National LGBTQ Health Education Center, which is a program of the Fenway Institute in Boston. And they have wonderful materials. But we found, as we went through the Cedars-Sinai Accelerator in Los Angeles last year, that there's clinician burnout in general. But then when it comes to adding additional training for clinicians, it's even worse. Some clinicians even thought that sexual harassment training was equivalent to LGBTQ cultural competency training. I found that shocking, but at the same time understandable given the pressures they're under. So we've taken the materials that are provided free to the public as it's federally funded, and broken them into digestible components that providers complete. And as soon as they do, we get notified that they've completed the course, as we call it, sort of an LGBTQ 101. And whenever a provider receives a patient from our platform, they're notified immediately that they are identifying as LGBTQ, coming from EqualityMD, and they're reminded of some of the key best practices to make sure that they engage with the patient while they're having that digital engagement.
Wow, that's very interesting. Yeah, and I think it's so important, right? Not to have just the rainbow washing, if you will, but true interest, like in being able to serve like the very diverse needs of the LGBTQ communities. So I guess I was just wondering, like, so say for instance, like if I were to get on EqualityMD, is it that, you know, I would be able to link to a dermatologist, a mental health counselor, if I have allergies, an allergist, et cetera, like would I be able to get all of my needs met on EqualityMD? And then would I be able to then like have a physician or a provider, like as you mentioned, match exact, like they would be part of the LGBTQ community, or as you said, like they have just taken the training, so it's a mix of people who might be identifying as LGBTQ versus those that are friendly and understanding.
Great question. I get this a lot. Um, many times in LA, I was approached by people saying, "You can finally connect me to a gay doctor," and I said, "Do the math. If if 10% of the nation is LGBTQ and X% are doctors, chances are you're probably not going to find one. If you do, that's fantastic, but that doesn't mean they're going to deliver good care." I've had patients come to EqualityMD and they've said that they've had LGBTQ providers who were just had terrible bedside manner.
Mhm.
And so just because someone identifies with the community doesn't mean they can't uh, forego the evidence-based cultural competency training because it's an evolving area of research and best practices. So the providers, there are some who identify as LGBTQ and some want to identify as such, but some, it's their personal choice not to do so. And we
Mhm.
respect their privacy. But all of them have gone through the training that we have so that you can at least rest assured that they know how to create the safe space where you can be your authentic self. So the offerings we have now, they are mental health care, primary care, and urgent care.
Mhm.
And certainly if you have basic primary care needs, allergy issues, some dermatological issues, you can certainly talk with a primary care provider about that. That we'll be adding some specialty services down the road as we grow, certainly after this Pride Month and through the summer. But right now we're focusing on what the community has told us is their primary issue, and that's mental health.
Mm-hmm. Yeah, absolutely. And it's just interesting. I saw some of the comments in the chat as well, right? Like for those of us who are part of the LGBT community, you know, what kind of providers we would want. And if you tend to find people who are on the platform that if they have the chance to be able to connect with an LGBTQ provider, if that's what they're doing. And then as you said, like the different types of specialists that are on there, some might say, oh, I want my neurosurgeon to be LGBTQ or you know, my orthopedic surgeon. So
Yeah, I had one of our investors and lifelong friend, actually a childhood friend, used to play hide and seek in third grade. But uh, he's his family and my family have been friends forever. His name's Ashton, and so he was saying, "Well, what about connecting me with an African American doctor who specializes in this?" And I said, "Ashton, there are 5,000 Black doctors in the country.
yeah.
How many of those identify as LGBTQ? How many of those identify or work in this specialty area?" And he said, "I get it, I get it." So we certainly are, the matching algorithm matches you with the best available connections, but we have to remember, even though we serve the patients nationally, the provider has to have a license in the state where you reside. That
Mhm.
is a rule, that is the law. So even if you have the best match possible, they might be in the state next door, and therefore they will not show up as a match for you because we can't do that.
Oh my goodness. I I can only imagine the frustration that may cause. But Dr. Lecomte, did you want to jump in or can we move on to the next one?
I actually was going to ask about that matching algorithm, you know, does it, because we're not just LGBTQ, we're also, you know, there's race and ethnicity and
Yes.
everything to be considered. So, is it an option though to like enter that criteria there just to see if there is someone that is available?
Absolutely. We can't promise anything because the network of providers that we're working with, our teleprovider, continues to grow. And they don't come in one by one, they come in provider groups. And that's a really good thing because that enables our teleprovider to bring down the price per visit that allows us to pass those savings along to the consumer. And because we're cash pay, no insurance, It removes the overhead. It removes the process of going through the mental gymnastics of, am I reaching my deductible? Does my level of insurance cover telehealth at all, let alone mental health? Does it cover prescriptions? So we certainly want to make sure that we find the best match possible. But at the end of the day, you control who you see. We'll give you some suggestions, but you handpick the provider you want. You can stick with that provider if you want to have continuity of care, particularly for, say, mental health sessions. But if you want to have a different provider and just try a different experience, you're more than welcome to do so at any time.
No, that's really helpful to know. Thank you.
I am curious.
Go
ahead. Sorry.
I was going to say, and what the end of the video said, we really value the feedback. We really mean that. As I mentioned earlier, I used to teach history, but I was at a naval boarding school in rural England. So it was a very interesting experience. As Winston Churchill said, England and the US, two great nations divided by a common language. But I learned more from my students than I ever could have taught them. And we can't build the right product for our community unless our community shares their experiences, what they want, what they like, what they don't like. That's often the negative feedback is often the most helpful as long as it's constructive.
Yeah, absolutely. I couldn't agree more. And I wanted to segue. You had some great statistics, Justin. I'm happy to have you pull them up now because I know one of the questions that we did have was, how EqualityMD is addressing the fact that 1 in 4 LGBTQIA plus Americans avoid seeking care or delay life-saving medical treatments.
Yeah, it's sad. So I'll start with this, and this is my story. And several years ago, I was at my dermatologist's office in Washington, D.C., and I had to wear one of those awful hospital gowns, like the ones you see in the photo. And I was very uncomfortable, as anyone has had to wear those gowns is. And I often use self-deprecating humor to alleviate my own tension and to hopefully build a sense of rapport with the provider. And I'd never seen this provider. It was just my in-network provider that I was assigned. And so when the doctor came in, we met, exchanged pleasantries, and I made a joke about being gay. And as he was about to begin the exam, he stopped and said, "I'm sorry, I can't complete the exam." He took off his gloves and walked out of the room and closed the door, leaving me feeling alone, ashamed, and unseen. The lawyer in me should have screamed, "Lawsuit, lawsuit, lawsuit," but I was so shocked that this was happening in our nation's capital not that long ago. That I got dressed and went to the receptionist. And when I told the receptionist what had happened, she said, "Oh, honey, I'm sorry. Why don't you talk to your people and see who you can find?" I thought, is this really the state of healthcare? And unfortunately, my experience is really not uncommon. 1 in 3 experience discrimination in a healthcare setting, as I did, causing 1 in 4 to avoid care altogether. 1 in 6 are denied care, and 1 in 8 live in states where providers can legally deny care, largely for religious reasons. And a huge component of this is there is a large lack of data about our patient population. And without proper patient journey data analytics, providers, health systems, and insurance companies don't understand how we behave as a patient population and as a consumer base. And as such, they can't authentically engage us in ways that meet us where we are. And that's a huge problem for healthcare. And that's another part of what we're trying to do with EqualityMD, is not just bridge the health equity gap in terms of delivery, but also the data gap that's been there since, well, the dawn of healthcare in America.
Yeah, absolutely. And I'm just wondering, like, the overall vision in the future for EqualityMD, like, are you going to be a real competitor to how healthcare is done? Or what does that look like?
I've only had a crystal ball that was accurate. Our goal is to change how our community perceives and receives care. We want to connect patients with providers who have the training necessary to create the safe space, eventually both virtually and in person, that utilizes data analytics so that we can transform those analytics into insights that are actionable. So health systems, payers, and employers can authentically engage more patients, meet them where they are, increase patient engagement, improve patient outcomes, generate predictive analytics. And we're also building a really, really interesting chat GPT that's LGBTQ focused. It's sort of like a LGBTQ coach for clinicians as well as insurance companies that they can use in real time to assist them in care navigation and communication with our community as patients, but also from the payer's perspective, because 1 in 5 of our community experience discrimination from insurance companies. So it's not just the provider issue, it's also the payer, making it a system-wide problem. Eventually, there are some companies that have approached us as potential acquirers, because a big question I get is, well, why doesn't Amazon do this? Why doesn't CVS do this? And it comes down to one word: trust. The community does not trust large corporations with their healthcare. A patient-provider relationship is one of the most intimate one can have. And when you have that broken, as it is currently now, given the statistics, you need to build that trust back up. And executives at the Amazons of the world understand this, and they're not attempting to create something for health disparity populations that span racial minorities, military veterans, neurodiverse, LGBTQ, et cetera. They're waiting for startup individuals like myself, like those at other great startup companies serving underserved communities, and absorbing their mechanisms, their practices, their algorithms, their community, and their trust into their ecosystem so they can authentically engage different patient populations in a more meaningful way that will enact healthcare equity in a way that they hadn't been able to on their own.
Mm-hmm. Yeah, that's very fascinating, that point that you say about the trust and why Amazon and other larger companies aren't able to do it, but yet they're waiting to, as you said, just absorb and like acquire. Is that potentially on the horizon for you, or do you feel like you want to always maintain that control with EqualityMD?
Well, first of all, no lawyer ever represents himself in any case. So I have a fantastic legal team, and to save money, they farm work off to me. And just because I'm a lawyer doesn't mean I want to do the work.
Right.
But they said, before we start, is this your baby or is this your business? And I said, it's my passion, but it's my business. And they said, okay, so you're a social entrepreneur, you're mission driven, but you do want to exit at some point. And I said, yes, in fact, at some point, I want this company to grow and grow to a point where I have to be replaced as CEO because I don't have the skill sets required. And if that means being acquired by a large insurance company or health system or a CVS or an Amazon, then so be it. And in those scenarios, similar exits I've seen, not in LGBTQ space, but in others, typically the CEO who started it and has that vision and the relationships stays on as an entrepreneur in residence, as an advisor of some capacity for 2, 3, 4, 5 years, and then goes off and does something else. I see that happening for EqualityMD because when we get to that point, we really will have been able to effectuate change in the way that we wanted to when we started this just a couple of years ago.
Yeah, absolutely. And this is kind of an interesting thing that just popped into my mind, but dental services, have you talked to other, I guess, things that are, ancillary to like the medical field, but easily could be absorbed? Do they have an interest as well as becoming a part of that?
They do. Dental is interesting because there's a growing focus on oral health and how it really is sort of the harbinger of everything else physiologically as well as mental health. And I'm glad that that's happening. I know nothing about oral health other than I go get my teeth cleaned every now and then. But it's important that we have these conversations because I have encountered individuals from our community who've said their dentist wouldn't do simple cleaning because they were fearful of contracting HIV, for example. One of our investors early on used to do his residency at a hospital in downtown Los Angeles. One night he was shadowing a doctor and there's a horrible car crash. A man came in on a stretcher with his boyfriend, partner, husband, didn't know the relationship, but it was clear that they were 2 gay men. And the doctor said, I'm not handling this. I don't want to get AIDS. Someone else take care of this, and walked away. And that was in 2017 or so, and in a major metro city. So these issues of sort of ancillary services, whether it be ambulatory care, dental care, even pediatrics, is something that we hope to address down the road, but we're starting with just those who are over 18 and those primarily who are uninsured, underinsured, as well as those who want to seek more inclusive healthcare options outside their covered networks, so they don't have to experience situations like I had with my in-network dermatologist that walked out the door.
Right, absolutely.
I think just listening to your personal story as well as the story you just told, I think a lot of folks think that is something that's happened in the past but doesn't happen anymore. And it just sort of shows like how naive that is and the need for this type of care. It's just something that popped into my mind, and I just wanted to vocalize it, not to interrupt the flow of conversation, but thank you. Wanted to honor that for a moment.
No, thank you for saying that. It's very true. I have received some very, very interesting, I'll just politely say, perspectives on what I do and why I do it. When I tell people that we're serving LGBTQ community, they say, why do you people need special treatment? And that when you people is always a great conversation starter. Oh boy. And then, well, why don't you just do this for everyone? And so, well, because there are health disparities that need to be addressed. We're all human. Yes, we all have similar physiological makeups, but we're all uniquely beautiful and different and have different identities. And those identities inform how we traverse this world, how we perceive this world, and how we think the world perceives us. And that matters. And that matters especially when we go back to that sacred doctor-patient relationship. So is this a niche community? Yes, but it's a $216 billion niche community according to PitchBook as a report in September of 2021. In Los Angeles, I was on stage, it was April of last year. It was in Orange County, actually. And I was on a stage and I sensed the audience was not receptive to LGBTQ issues at all. And I didn't know this before I signed the pitch. So I turned to my VP of product, who was the first hire at the popular gay dating app Grindr. And he said, you're going to alienate 90% of the audience if you do what you told me you're going to do. And I said, I know. but those 10%, they're my 10%. So I got up there and I mentioned that the LGBTQ population represents about 30 million Americans, 21% Gen Z, and that's rising. It's a $216 billion industry. People shouted, you lie, get off the stage. They walked out. I couldn't have been happier because those that stayed, I had some of the best conversations with and even got an investment out of it.
Wow, that's amazing. Good for you. Good for you.
I just had a quick question. You were talking about Amazon or trying to be absorbed. What do they want to do with the platform? Do they tell you, or? It's
interesting. It's more about the data. As I mentioned, the large part of the reason these systemic inequities continue to exist, they're exacerbated because without the data, people can't make informed decisions that are data-driven. And we are the AI platform that we're building that will eventually move the patients from our initial telehealth product to the full service virtual first data analytics and health tech platform will collect valuable SOGI data, SOGI, sexual orientation, gender identity, social determinants of health, consumer behavioral data, and that includes what consumers prefer to buy when they treat everything from a sprained ankle to some sort of hereditary disease and how they go about their patient journey. Having that information will enable providers to understand how to authentically engage and put out communications to the community other than just waving a rainbow flag during the month of June and putting it back in the closet in July. And that's what we aim to do, is capture that data, obviously totally anonymized, but create different data sets based on different zip codes, different healthcare conditions, and make sure that people who are making decisions in healthcare spaces have the information they want. And we're finding that it's the insurance companies, the big companies like United Health Group, many of the Blues programs, they are calling us. They're literally calling me out of the blue, saying, we've done some research and you're apparently the person to talk to about LGBTQ health equity. And I'm honored, humbled, and and sometimes honestly scared at the same time because it's a big responsibility. We're doing more than selling a product, we're selling a promise. And I take that very seriously.
Thank you.
Yeah, absolutely. That so such powerful words. I'm like loving this this conversation, Justin. And so I just wanted to tease out a little bit more about some of the obstacles that you may have encountered in terms of policies that may exist, because you did mention like it being able to get certain providers depends on states, right? Because physicians,
Yeah.
you know, you're certified like in one state, some people might be with a few, but just talk about that policies that you've you know, had to deal with that might have fettered your progress?
In terms of the policies, we haven't really run afoul or against any that have prevented us from operating. Certainly, there are providers that if they don't want to serve LGBTQ patients, we don't want them on our platform. And there are states that allow that. There are 7 states that allow that. Providers can deny care, which is just beyond me because it goes against the entire Hippocratic Oath. But the different telehealth policies, I would urge state lawmakers to expand what's covered, and that includes insurance companies, so that even the lowest threshold, say if there's a gold, silver, and bronze platform, say the bronze platform is the entry level, that should cover telehealth services completely, especially mental health, because that barrier to care is a huge reason why a lot of people aren't even seeking care, because most people in our community, I found through lots of different studies, through marketing and research firms, have found that we embrace technology more quickly, are more readily accessible to it, and are more willing to have those telemental health sessions virtually and prefer that over having an in-person appointment. In fact, during our MVP testing and validation phase of 21-22, a lot of the patients we had were having telehealth sessions on their laptops in their dorm rooms, in their cars, in their basement, in other places where they could feel safe, and they rather than being outed by walking into a medical building.
Yeah, absolutely. That really strongly resonated to me, like where people wanting to get their care, right? And the number of people who are taking calls, you know, be it telehealth calls or others in their basement, in their car. I know, for instance, I've had a few phone calls where people have been on their phone, like taking a major meeting. So I think that's particularly important. But I wanted to shift gears again, Justin. So I know we've talked a lot about EqualityMD, but I find you very interesting. And so if you could, you know, expand my perspective and maybe the audience. So as a healthcare entrepreneur, so a lawyer, a history teacher, and now healthcare entrepreneur, and many things obviously that we've learned about you as well. Is that fairly unique? Are there more lawyers going into healthcare entrepreneurship as a physician entrepreneur, you know, straddling, you know, healthcare entrepreneurship now? I find that I meet mostly people who are physicians, you know, or somehow were in that space before. So I do find it unique, but I'd love you to speak more, you know, kind of about that, either the rarity of your case or the fact that like you are one of many.
I'm certainly not one of them. In terms of the lawyers becoming a health tech entrepreneur, I haven't met one yet. I've met lawyers that work within some health tech firms, but that's not unusual because it makes sense. I've met many lawyers who are entrepreneurs themselves, but that's usually for their own solo practice or a small private firm. But it's rare for lawyers to dive into healthcare. There are a few if they've had some healthcare experience, as I have, but it's not common. And but at the same time, whenever I go into a room, sometimes I somehow there's like this magnetic pull. I just find the lawyers. I don't know if you're like that with doctors, but when I talk to them, I tell them what I do, and most of them just think I couldn't have that type of unstable life of being an entrepreneur. And the fact is, most can't. I think that's the biggest misconception of being an entrepreneur, is that you make your own schedule, you live this glamorous life. It's anything but. It's nose to the grindstone, the ups and downs, the highest highs, the lowest low can happen within the same hour several times a day. So you have to be beyond resilient, have that grit, and also have the backing of a strong support system. The idea it takes a village comes to mind. I am not alone in any of this. I am surrounded by people who are extremely intelligent, and I make a point of surrounding myself with those who know things that I don't, so they complement my skill sets. I don't want yes people around me. And we're blessed to have over 100 different mentors from different disciplines, and from technology to medical healthcare practitioners to those who understand the policy issues. And without all of them working together, and I don't speak with all of them every day because I get things done, but I know that I can call on them and they're willing to help because they believe in what we're doing and they understand the need. And I think that's extremely powerful, is to surround yourself with those who believe in what you're doing and you as a person and not just your idea.
Yeah, absolutely. I think that's fantastic, the support system that you can have. And I know we were chatting earlier before we actually let the audience in, so I'd like to bounce back to where we were there. The strategy of being an entrepreneur, and there are different ways that people may approach it. And one of the things that you've done, you've mentioned even during our conversation now, is being part of different incubators. So I wondered if you could expand upon that a little bit more for the audience, as how that strategy has worked for you, how it's worked for other people, as in gaining momentum, for whatever business they might be doing in healthcare.
I think any entrepreneur, particularly in healthcare, it occupies a fifth of our nation's GDP. It's massive, it's complicated. I don't think it's ever going to get uncomplicated, unfortunately, but we can at least make it more accessible to those who have been underserved, historically speaking. So I've made a point to find those partnership potentials, whether they're entrepreneurial focused, like Startup Health, we're a portfolio company of theirs, Scale Health, Rock Health. I was a Rock Health Innovation Fellow. And then we just, in the fall of last year, in October, completed the very competitive Cedars-Sinai Accelerator. Out of over 1,000 companies that applied worldwide, they took 10. And they were silly enough to select us as one of them. And it was wonderful to have that immersion with a massive healthcare entity and see how they address health equity issues, either rightly or wrongly. And we were starting to work with their LGBTQ brick and mortar center to see how they approached that issue, but they still struggled with that barrier of trust. So we're continuing to work with them as they see us as a trust bridge to a community they know is out there, but they don't know how to engage. That also allowed us to build relationships with big insurance companies, smaller community payers, more LGBTQ community clinics across the country, and expand our network, because those relationships, to be able to have a big company, big insurance company, doesn't matter what name, sign on a dotted line as a partner, it takes years. It just doesn't happen overnight. So I wanted to have that before we started really diving into more to the AI platform that we're continuing to build based off the MVP tech architecture that we built a couple of years ago. And those are really, really helping us out because they're helping us avoid some pitfalls, because we're really focused on this, not this. But I wouldn't have that inside baseball knowledge if I didn't have those relationships. And that's one thing that I've really focused on, is the relationship aspect of it. Because it's not just the name, it's not just the company, it's the people you're working with. Just like investors bet on the jockey, not the horse, it's the same with relationship building and partnerships. And then we went through, just completed in April this year, just last month, a social impact driven accelerator in DC called Halcyon. And we were their first, one of the first members of their healthcare class. And that was a truly exciting experience because this, unlike every other health tech accelerator or technology accelerator for that matter, that's not healthcare related, it's residential. You live on site. And it was really exciting because we got to live in this big mansion right on the Potomac River in Georgetown. And we woke up and got ready and went to school. And we helped each other with our pitch practices. And it was really a community coming together, helping each other really become their best selves and overcome their personal insecurities and their own challenges, and helping make connections.
Oh my gosh. Yeah.
So I'm sorry, Justin, it sounds like the importance of the relationships is not just with the organizations running the accelerator, but the folks you met through the process. Am I right?
Yes. The mentors are invaluable. They'll throw at you, I think at Cedars-Sinai, we probably met with literally over 100 different potential mentors.
Mhm.
And some are C-suite executives of corporations, some are nonprofit leaders, some are surgeons, some are community healthcare workers. It's very, just everything. And we're not going to utilize all of them, but we've kept the ones that made the most sense, those relationships alive. And we're looking down the road to see who might be able to help us as we grow. And maybe not now, but just keep them up to date as to where we are, where our journey's going. It's never a straight line. You have to be nimble and adjust to the landscape as it evolves. Sometimes as it evolves, it throws boulders at you and you have to avoid them and laugh and roll with the changes. But having those relationships is critical. So it's not just you go and learn. You have to go out into the community you're in. So I grew up in the DC area and I brought some of my classmates who, some of whom had never even been to America, which was great. It was a global accelerator. And I brought them to places like the Kennedy Center. I graduated from high school from there, but they'd never even been there. And it was really cool to sort of show off my hometown, but at the same time, bring them to networking events that I've been going to in the sort of greater DC, Virginia, Maryland metro region that help them create their own relationships by making introductions for them. And I find great value and purpose in helping other people connect with others who can help each other create that partnership or help them on their journeys that has nothing to do with me, because I know that the universe will give you exactly what you need when you need it, never when you want it.
Is that not the truth?
Yeah.
Absolutely. So, I will cue our audience to start thinking about your questions because we'll go into our Q&A shortly. But Justin, you've been answering some of the questions already in terms of like your life advice about entrepreneurship in general, about leadership within the space. But I'm very curious if you could describe, one of your best days with EqualityMD and then juxtapose that to one of your worst days. And then maybe any kind of insights from there. Kind of a curveball question. But
I don't know. It's like every day's I'll say this. I was born in Las Vegas, and Liberace's my godfather, and it's home, but not. And I got the opportunity to pitch on stage at the Las Vegas Convention Center, 2 blocks from the hospital where I was born, 1 block from the hotel where Liberace announced my birth on stage, in front of thousands of people in the healthcare industry at the big health conference, HLTH. And that was just the pins and needles exciting because never give a lawyer a microphone, but at the same time, I was able to sort of channel that creative spirit. I couldn't walk around the stage as I wanted to because I had to stand in my box for the camera, but I was able to have fun delivering the pitch, and people commented afterwards, "You really enjoyed that?" And I said, "Hell yeah, I did." And even though no investments came from it, the satisfaction of being there and having Cedars back me, back our team, back our vision, our company, was just, I worked so hard for that. Our team has worked so hard for that. And our advisors who put their belief in us a couple of years ago, we're so proud of us for that. And that even though not a penny came in, didn't matter. As I met new people, I started new relationships that at some point might turn into something else. Bad days, there was one investor, 2021, early 2022, that had committed $500,000 and then pulled out after ghosting us. And that's not uncommon, I later found out. But we had sort of planned and started doing some hires and making some moves to accelerate our product. At the time, it was still that platform we were building ourselves. But it turned out that not getting that investment and that gut punch that left us sort of bewildered, I had to take some time off and just say, what the hell am I going to do now? These people were relying on me. I never pay myself. I always pay everybody else first. And what am I going to do? It turned out that was a good thing because we weren't ready at that time for that amount of investment. But I didn't know that. And sometimes it takes several gut punches to realize that that's exactly what you need.
Mm-hmm. Wow, I think that's absolutely powerful, Justin. I love, like your best day, right? So for those of us who are entrepreneurs or budding entrepreneurs, in the audience, right? Like from the positive story of you never quite know what that return of investment will come in, right? It may be financial or
Mhm.
non-financial, and you never know if it's going to be immediate versus it could be years down the line. But then at the same time, right, with some of those difficult things, and I think that's something important that people don't learn in entrepreneurship class, right? About things like that, being ghosted by investors, or the
Mhm.
fact you don't know what you don't know. And then, yeah. So I guess my follow-up to you is how long did it take you before you realized, wait a second, this was actually a good thing? Was it like a week? Was it a couple years?
It was a few months. Um, I had some deep conversations with our existing investors. Uh, I had to shed some of our team, which turned out to be a good thing too, because it wasn't the right fit. But I didn't know that at the time either.
Mhm.
But in the process, I started having more conversations and being more vulnerable as an entrepreneur and sharing how the fact that, you know what, I'm struggling financially. Are there any individuals, angel investors that you know that believe in us, that can have a conversation? And you never ask for a check the first conversation. The whole point of a conversation is to have a meeting later, and then hopefully a second, a third meeting. But it's having that's showing that vulnerability is one of the greatest superpowers each of us has as an entrepreneur. Tapping into that is so empowering. Yet I don't think enough people are doing that. And those that do, man, oh man, they soar. And it's really amazing to see. And that means different things to every individual. So every entrepreneur has to find their own path of vulnerability. They have to explain to others, here's why I think we'll fail. And
Mhm.
by doing so, you're scrutinizing and really thinking about how you're approaching the problem you're solving from a different perspective, from a different viewpoint that you might not have otherwise, in challenging yourself. And if you're not willing to do that, if you're just willing to drink the Kool-Aid all day that you made yourself, you're not going to go very far. It's a hard road. As I say it all the time, it is not for the faint of heart. And it is truly for those who are insane. But you have to be insane to build magical things.
Mhm. Mhm. Yeah, so I mean, I'll just reiterate what you said because I find it very, very fascinating and very refreshing and unique. I haven't quite heard it before, but don't drink your own Kool-Aid. Have the power to self-reflect and self-criticize because I think that's so important and something that, I think myself, I do as well, right? Because if you're drinking your own Kool-Aid, then you might be headed right towards some significant
Yeah.
failure as opposed to being able to have that, as you said, and as Brene Brown says, right, that power of vulnerability as an entrepreneur. For one, people being able to, I think, trust you and being able to say, you know what, I can help you out, but then at the same time, right, to not be so self-aggrandizing with what you're trying to accomplish. But I'll open it up to the audience with any questions that people may have. Feel free to either put that in the chat or in the Q&A. There may be one.
We have a
And we
question here, asking about EquityMD and whether or not it includes LGBTQ positive folks who are disabled or have disabilities.
yes. I'll say something I've actually never said before. I have a disability, neurodiverse. It's called myoclonisis. I was diagnosed at 27, and it's basically the muscle spasms that you have when you're asleep. I have when I'm awake, and they're uncontrollable. Washing dishes, I accidentally throw glasses across the room. And when I do a public speaking, you know how you get those nervous butterflies, and when you're speaking, you're supposed to transform them into positive energy. Uh, I can do that, but the diagnosis sort of blocks my jaw, and so I have to take medication for that. And it's annoying because I have to plan my speaking engagements around different medications I take so that I can be who I am. So absolutely, we try to build that into our platform, and as we continue to grow, particularly with our AI platform, the Virtual First, that we're continuing to build, that will absolutely be something we focus on.
That's
Awesome.
wonderful to hear. Dr. Carpenter, if it's okay, I can ask the next question that's popped in.
I was just going to say that that is amazing, and so I just wanted to underscore that point as well, Justin. You know, succeeding in entrepreneurship does not mean that you have to be that you're perfect all the time, right? Is that succeeding in spite of certain obstacles that we might have personally, that we might have professionally, relationally, et cetera, financially, et cetera. So just want to continue to put that out there to people that, yeah, that things can be hard, but we, as Justin does, right? You find ways to be able to succeed, even though you have other things that you're trying to manage. But yeah, next question, Cersei.
I would even reframe that. You can succeed in spite of and because of things that might prevent you from achieving goals as easily. And being an entrepreneur is I often equate it to a duck on the pond, gliding effortlessly, but paddling like crazy underneath that nobody else sees. And that's what we have to do, because you have to portray strength, but at the same time, know when to show people what's under the surface of the water and all the hard work you're doing. And being careful to do what Liberace taught me, know your audience. Don't be vulnerable to everybody all the time, but also don't be afraid to take your cards away from your chest and show them to others in the right moment with the right audience.
Yeah, absolutely. Absolutely.
Well, your godfather knew a bit about showmanship. So.
Just a little bit, yeah.
That's incredible. But I think one of your, and also I want to say, I love the fact that you saw this need and you're just working so hard to fill it. And one of the commenters, someone had a question, Michelle Lynn Fair, said, you know, she's talked about it being an excellent resource and a role model for equity in healthcare. And she says, bravo to you for your courage and commitment to medical access justice. She wants to know how she can get the word out to her clientele.
We're doing some internal bug fixing right now, but we plan on doing a larger launch in the coming weeks for the telehealth platform. The deal we're offering is just, it's almost too good to be true. But as I said, it took 9 months to negotiate, and that's where my lawyer hat came in. So for anybody who wants to go to EqualityMD.com and you can sign up. But the offer we're giving is for $79 a month. You can get 12 mental health sessions a year, full 50-minute sessions, 12 primary care sessions a year, 12 urgent care sessions a year, and access to over 1,000 medications delivered discreetly to your door, including PrEP, all included for $79. No shipping, no visit fees, no copays, no deductibles to worry about. It's cash pay, and it's extremely affordable for those who don't have insurance, who are underinsured, as I said, because not all insurance covers the types of telehealth, particularly mental health. And even those with insurance aren't happy with the doctors that they are assigned, just as I wasn't with my dermatologist. So in terms of getting the word out,